One man's trash is another man's evidence. This is Hidden Killers with Tony Bruschi.
This is one where I would be beyond words. I mean, I don't know what I would do here. And I don't know how this even happens. Dr. Thomas Shaknovsky. So put that in your little mind's Rolodex of if they say, Dr. Thomas Shaknovsky will be performing your surgery today. Run. Even if you don't have legs, run. The Florida surgeon is accused of mistakenly removing the liver of a Muscle Shoals man during a surgery intended to remove his spleen. He has surrendered his medical license in Alabama. On Monday, the Alabama Medical License Commission accepted Dr. Shaknovsky's full license surrender weeks after the death of a 70-year-old William Bryan. The commission had previously suspended his license in October, citing concerns that his continued practice posed an immediate danger to his patients and the public. Bryan and his wife, Beverly, were in Destin, Florida on August 19th when Bryan experienced pain on his left side. A Florida doctor diagnosed him with a spleen issue and insisted on performing emergency surgery. Despite Beverly's plea to return home for treatment in Alabama, the doctor warned that Bryan would bleed to death if moved. On August 21st, Dr. Shaknovsky performed the operation but removed Bryan's liver instead of his spleen, resulting in Bryan's death on the operating table. A pathologist later confirmed that the organ labeled as Bryan's spleen was in fact his liver. The tragedy triggered an investigation by both the Florida Department of Health and the Walton County Sheriff's Office. Florida health officials suspended Dr. Shaknovsky's medical license on September 24th after reviewing the case, and another in May 23, where he allegedly removed part of a patient's pancreas instead of an adrenal gland during surgery, causing permanent harm. Dr. Shaknovsky's was licensed in Alabama since 2016. He's faced prior allegations of surgical errors. Jesus.
Does he keep getting to perform surgeries?
According to it's pretty scary when the guy at the beach is like, really, let me cut into you. Let me do your surgery. I'm a doctor. Trust me.
Well, and I wonder and I wasn't clear when I first came across this story, if when he got sick, he went to like an ER and they're like, you have to have surgery. He just talked to a regular doctor and then here's who's going to perform your surgery. Like happens frequently.
Yeah.
That's kind of what I thought happened. And maybe that doctor was like, you can't make it home. You know, you have to have this surgery. And the poor guy should be alive today.
Yes, he should be.
Oh my God.
That's anybody that's very eager to operate on you when you really don't know them very well. I would be a little questionable.
And it's sad because you're in, you and I have never been in medical school.
No.
And if somebody's like, you're going to bleed to death if you go home, you have to have this surgery.
Yeah.
You have to believe what they say.
Well, and you do. And I would, in that moment, I'd probably be thinking the same thing. And like, well, do you even have time for a second opinion? You probably don't
You might not
if you're
have.
going to bleed to death. So you're thinking, I got to rely on these guys saying I got to do this.
The surgeon should have known the difference between a spleen and a liver.
Hey, I was in that situation once, actually, where I went in and they're like, you have to have a surgery like right now. I'm like, what? And that was my appendix when it burst. And I had I didn't get a second opinion. It was like I was in a lot of pain, too. So I'm like, okay, do what you're going to do. But who knew? I mean, he could have, taken out my liver or taken out, just accidentally mixed that up. It's a wixy thing that you can easily do. I can get why a doctor, accidentally takes someone's heart out instead of a big toe.
Well, what about the other people in the operating room? They had to have known once it happened, like, that is not the guy's spleen. That's not a spleen.
Is this just like the ultimate example of how we are in a world where everyone is so completely unaware of their surroundings and what is going on around them? And nobody speaks up when they say like something's wrong or off. It's just like, oh, well, that's not my job. I'm just here to do this,
Well, because like when I had my hip done, I had my hip replaced. On the other hip, they wrote in marker, not this hip. And it went down my leg. Like it took about 2 weeks for it to come off. Not this hip.
Yeah.
So, they can't do that, not this liver. But you know what you're going in there for. And they double check. And there's all these checks along the way, too. What are you having done? What are we doing? And we're doing this. They're just double and triple checking. And there had to have been a system in place for we're taking out the spleen, period.
Yeah.
So I'm going to guess there was people in there that knew and couldn't stop him from doing it. Because he's the doctor. You would just be the nurse or somebody or the anesthesiologist. I don't know.
Yeah.
That is just crazy. But to me, if you take out the wrong organ and it's such an obvious error because they're very different organs, I think that's a criminal charge. He killed that guy.
Yeah, I would say criminal neglect. Wouldn't I mean, yeah.
Because it'd be one thing if they did the wrong hip. Oh, I thought it was her left hip. Shit.
The first thing I'd be doing is drug testing on, because it almost sounds like that. Like this guy's out of his fucking mind or something.
Well, and he's done things before, surgical errors. But then when you're in an emergency situation, you're going to assume the person who is doing your surgery is qualified. Because I was even nervous when I got my hip done. I'm like, how good are you at this?
Yeah.
Like, do I need to find somebody else? Are you the guy?
Yeah. Can I see your greatest hits videos?
Because I kind of would like to know. And then it was funny because I really did feel confident in the surgeon. So this really wasn't funny, but I ran into this guy who I really don't like. And long story, but he's one of those people who knows everything about everybody. Always his opinion is right. He talks louder than everybody else. He wants to be the center of attention. And I only know him from working in radio, and he's a listener back in the day. And so I go out and I run into this guy, and I'm walking up and he goes, "Why are you limping?" And I'm like, oh my God, it's him. And I said, well, I need a hip replacement. And he goes, "Oh, when are you getting that done?" And I told him whenever it was. And he says, "Well, I hope it's not Dr. Bagarva." Well, as a matter of fact, it is. He goes, "He ruined my wife's knee." And then he starts going off about his wife and his ex-wife. And I'm like, I don't give two shits about what you think about this, doctor. I'm not going to let you influence but I'm like, of all things for him to say to me, like, who would say that? Well, I hope Dr. Bagarva's not doing it because he's horrible. Well, he is doing it. And he did a great job. I will say that. Hats off to Dr. Bagarva. He did a great job.
I actually have a story somewhat similar that was just completely odd and random of what someone just said to me, like in a parking lot. I was going into Menards in Wichita, and this is it would have to be probably about 14-ish years ago. And just at random, some guy's pushing a cart back into the return, and he just starts talking to me. He's like, don't ever trust your money with so-and-so. And it was the State Farm agent. And I'm like, oh yeah? And he's like, yeah, just lost all my savings or whatever. He had this little rant he was going on. And the weird part was, that was the exact agent that I had just hired a couple weeks ago, at the recommendation of my tax person or something. I've never had a single person in my
life. Why are you randomly talking about that?
I have never had that happen. That somebody would just come up to you like that, and it just was like, what? what? And like, then to know what who that person is, and like, is this like an omen? Should I like get all my money away from this person or what? You know? But I kept it there. I didn't really make much while he was managing it, but yeah, totally random.
Yeah, it's like that guy.
Yeah.
So, and a lot of times, when you do have surgery, and especially in this poor couple's situation, they didn't have a choice.
No.
And this guy killed him. And to me, he should be held criminally responsible. You, as a doctor, should know, because his spleen is significantly smaller than a liver.
Yeah.
They're in different places in your body.
I mean, this would be the work of someone who like practiced by playing Operation.
Exactly.
And yeah, so yeah, I think this person probably needs to be criminally investigated. There's something weird. So it could be like I'd be looking at his like writings. I'd be looking at anything digital, because I mean, this could be they enjoy doing this sort of thing. I don't know.
I don't know, or he just doesn't pay attention, or is he the guy who really didn't pass medical school? Like, what's the issue?
Or he's not really a doctor.
Never operate on anyone ever again.
Exactly.
All right, true crime addicts, let's cut the crap. You're knee-deep in the gory details of your favorite podcast when suddenly a commercial hits like a bad meal. Seriously? You deserve better. Upgrade to True Crime Today Premium Plus on Apple Podcasts, where you can binge without those annoying ads. Plus, get extended interviews that go deeper into the darkness and early access to episodes so you can be the first to know. It's like trading up from fast food to fine dining, but with more blood. So, go ahead. Search for True Crime Today Premium Plus on Apple Podcasts. Subscribe and feast on the good stuff.